When taking Ultomiris Vial, it's important to follow the instructions provided by your doctor and pharmacist. This medication is administered through a slow injection into a vein by a healthcare professional. After the first dose, it is usually given 2 weeks later, then every 4 or every 8 weeks, depending on your medical condition, weight, and response to treatment. Reactions may occur with the injection, so it's necessary to remain in the hospital or clinic for at least 1 hour after the injection. It's important to notify your healthcare professional immediately if you experience symptoms such as low back or arm/leg pain, pain with the injection, chest pain, shortness of breath, bad taste in mouth, dizziness, drowsiness, or feeling faint. It's crucial not to stop using Ultomiris Vial without consulting your doctor, as your condition may worsen. If you do need to stop the medication, your doctor will monitor you for at least 16 weeks to ensure that your condition does not deteriorate. Be sure to communicate any changes in your condition to your doctor. If you experience headache, nausea, diarrhea, dizziness, or muscle/joint pain, be sure to inform your doctor or pharmacist. This medication may lower your ability to fight infections, so it's important to watch for signs of infection such as sore throat, fever, chills, or cough. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember to contact your doctor for any other side effects not listed here. Before starting Ultomiris Vial, make sure to tell your doctor about any allergies you may have, as this medication may contain ingredients that can cause allergic reactions. Also, inform your doctor about your medical history, especially if you have had recent infections or vaccinations. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, as they can make this side effect worse. Be cautious when driving or using machinery until you know how this medication affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. Ultomiris Vial may increase your risk of certain infections, such as the flu or colds. Make sure to discuss your vaccine history with your doctor and ask if you need any vaccinations before starting this treatment. Also, avoid close contact with individuals who have recently received live vaccines. If you have any upcoming surgery, make sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant, only use this medication if it is clearly needed and discuss the potential risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it is not recommended to breastfeed while using Ultomiris Vial and for 8 months after the last dose. Talk to your doctor before breastfeeding. It's important to be aware that Ultomiris Vial can interact with other medications, which may affect how well it works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Share this list with your doctor and pharmacist to ensure they have a full understanding of your medication regimen. Do not make any changes to your medication dosage without consulting your doctor first. This will help to ensure the safe and effective use of Ultomiris Vial. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, you can contact a poison control center for further guidance. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It is important to have lab and/or medical tests, such as LDH levels and complete blood count, while using Ultomiris Vial. These tests should also be continued for 4 to 12 months after stopping the treatment, depending on your condition. It is important to keep all medical and lab appointments. It's crucial to take Ultomiris Vial as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to establish a new dosing schedule. This medication, Ultomiris Vial, is administered in a clinic and should not be kept at home. It is used to treat certain blood disorders and is given by a healthcare professional. The dosage and timing of the medication will be determined by your doctor based on your specific condition. Always follow your doctor's instructions for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.